Miss Purple, the right mind for any time. I created this podcast to raise the awareness of mental illness. If you have any of these symptoms, notify your physician or call 911. Another suicide hotline is nationwide is 988. Thank you. The right mind for any time. My name is Deborah Ann Sanders, aka Mrs. Purple. I had 30 years of nursing plus, especially in mental health. I started my career as a nurse attendant, a Candy Stripe, LVN, RN, BSN in nursing, and 2 years of graduate school. I was employed in various hospitals in Los Angeles County. The topic that I'm going to expound on today is what is dementia. The information that I give you can make you think or make you aware, or it can be used to help your neighbor or yourself. What is dementia? Dementia is an umbrella form used to describe different groups of the brain. Loss of cognitive ability, function, your thinking ability, and reasoning, and also the behavior ability that impairs a person's ability to perform everyday activity. Some people with dementia can't control their emotion, and their personality may change. The symptom of dementia that's occur when nerve cells called neuron in the brain deteriorate and die. Everyone loses some neuron as they age, but people with dementia experience far greater loss. While dementia is more common in older adults, unlike dementia, age-related memory loss is not disabling. Also, dementia is ranging from the early stage of dementia to the mid-stage of dementia when it's just beginning to affect the person, to the latest, most severe stage when a person must rely on others for help with all tasks of daily living when they have dementia. Dementia also causes problems with the ability to think, reason, solve problems. For example, a person with dementia may get lost in a familiar neighborhood, forget the name of a close family member, have trouble following a familiar recipe, or keeping track of monthly bills. Some people with dementia exhibit personality changes, depression, anxiety, agitation, paranoia, but certain type of dementia can also cause issue with movement and also the balance. Now we're going to get into the type of dementia. The type of dementia, Alzheimer, is very familiar. Alzheimer was coined after a doctor named Louis Alzheimer. He was a German doctor who, during an autopsy in 1906, discovered physical change in the brain of a female who had died from a strange mental illness. When he found the plaque on her tangled brain, signs that are now considered features of Alzheimer. Alzheimer's disease is the most common cause of dementia. It accounts for 60 to 80% of all dementia cases. Alzheimer's is a chronic neurological disorder, impaired thinking, personality and mood disorder. Eventually, Alzheimer's destroys the ability to carry out even a simple task. Alzheimer's disease is currently the sixth leading cause of death in the United States and may rank third as a cause of death for older people. Some of the early onset of Alzheimer, also called the young onset Alzheimer, is a relatively rare form of dementia that strikes people under age 65. Most people with early onset Alzheimer develop symptoms in their 40s and also 50. It's estimated that over 200,000 Americans suffering from early onset Alzheimer. Symptoms are the same as the senior disease. Some of the warning signs of Alzheimer is memory loss that disrupt your daily life. Planning or problem solving is a challenge. Difficulty completing a familiar task. Confusion with time or place. New problem with words in speaking or writing. Trouble understanding visual image. Withdrawal from work or social activity. Mood and personality change. Individuals who live with Alzheimer may become confused, suspicious, depressed, fearful, or anxious. There are different types of dementia. I'm just going to mention a few. One of them is called vascular dementia. It's the second most cause of dementia. It reduces or blocks the blood flow to the brain. Common symptoms include confusion, memory problem, unsteady gait, trouble controlling urination, or need to urinate more frequent, slower thinking, and difficult with problem solving. Another form of dementia is frontal temporal dementia. It usually happens at the frontal temporal lobe of the brain and is a group of disorders that caused by the degeneration of nerve cells in the frontal and temporal lobe of the brain. These are controlled personality, behavior, and language. Symptom of frontal lobe dementia varies depending on which part of the brain is affected. Some people experience dramatic behavior and personality change. Another form of dementia called the Lewy, L-E-W-Y, body dementia. The Lewy body dementia are abnormal deposit of a protein called alpha-synuclein. It's found in the brain of people with Lewy body dementia. Alzheimer's disease and Parkinson's disease, these deposits impact thinking, movement, behavior, and mood. People with Lewy body dementia may experience visual hallucination, difficulty sleeping, and problem with focus and attention. The last but not least is called mixed dementia. People with mixed dementia have a combination of two or more types of dementia occurring simultaneously. The most common combination of dementia is Alzheimer's disease and vascular dementia. Autopsy studied that the brain of people of 80 and up who had dementia indicate that many had a combination cause such as Alzheimer's disease, vascular dementia, Lewy body dementia. Some of the ways to prevent dementia or manage your dementia is keep cognitive fit. Mentally stimulation activities such as reading, solving problems, puzzles, playing games might delay the onset of dementia. Also, eating a healthy diet. Eat a diet that's with nuts and also a lot of fruit and vegetable and especially fish. Another thing to help prevent dementia is exercise. Physical activity can prevent a person from onset of dementia and slow its progression in those already exhibiting symptoms. 30 minutes of moderate exercise 3 or 4 times a week. Manage your cardiovascular risk factor, including high blood pressure, hypertension, high cholesterol, builds up fat in the artery wall, atherosclerosis, and obesity. Another part that contributes to dementia is smoking. Sleeping have a big thing to do with dementia. 7 to 9 hours of quality sleep per night may help reduce the risk of Alzheimer. Get your vitamin. Low the level of vitamin D, vitamin B6, B12, and folic acid increase dementia risk. It's best to get your vitamin through a variety of diets of healthy food rather than through supplement. Some of the risk factors for dementia is your age, your family history, high blood pressure, uncontrolled diabetes, high cholesterol, smoking, heavy alcohol use, depression, and lower education level. This ends my topic on dementia. Thank you for listening to With the Right Mind for Any Time with Mrs. Purple.